Desislava Krasimirova and her daughter live in the Hristo Botev district of Sofia, the capital of Bulgaria. It's a poor neighbourhood and she, like most of her neighbours, is Roma, so money is tight. But it's when she or her daughter need medical help that she feels the gap between herself and better off Bulgarians.
If a Roma person goes to a doctor and doesn't have health insurance, they're supposed to pay for the medical consultation at a price of 20 to 30 leva. And if the Roma cannot afford to pay, then the doctor becomes very hostile and they just tell them to leave in a very impolite way.
It's the same for other vulnerable groups. Bulgaria brought in a new health system with medical care and other services funded through compulsory medical insurance, with a fee for every visit to a physician or a day spent in hospital. Those without jobs or an entitlement to social welfare benefits found themselves excluded under the changed system, which drew a complaint from the European Roma Rights Centre based in Budapest, Hungary.
We argued that there was a disparate impact on Roma of all of these changes. The Committee of Social Rights, in some cases, in one of the cases we brought, found that it wasn't even necessary to get to that question of whether the Roma were adversely impacted. They found that the changes that Bulgaria tried to impose were in violation of its international commitments, and of course those changes affected not just Roma but non-Roma as well.
The action was brought under the European Social Charter, a Council of Europe treaty on everyday human rights agreed half a century ago and ratified by 43 of the Council's 47 member states. It covers ordinary aspects of life and complaints brought under it are taken seriously.
It concerns housing, health, education, employment, social protection, non-discrimination. So you understand that it's extremely important in everyday life of the citizens.
Well, if you look back over the Charter's long history, it has repeatedly set standards. It has basically clarified what are the nature of social rights and what are the obligations that come on state parties.
Miroslav Stefanov is mayor of the Filipovci area of Sofia, another predominantly Roma community. He's proud that it doesn't have the drug problems common elsewhere. But he's disillusioned with politics and politicians who only seem interested in the Roma when they're canvassing for votes.
Politicians are well aware of the problems that exist in Roma neighbourhoods. However, they like to keep the conditions as they are deliberately, so that Roma people are more easily manipulated when it comes to voting in elections.
So far, he's been unable to get anything done about the open sewer that runs through his community, sometimes flooding low-lying homes. It's not as if the Roma show a lack of enterprise. Back in Hristo Botev district, this cafe has been opened by a Roma family. Customers, though, have also experienced problems over healthcare.
We've got no bathrooms here. We've got no toilets. We don't have running water in our community. Most of the people here suffer from all kinds of diseases because they cannot afford to pay health insurance, so we cannot enjoy life according to European Union standards.
But the Social Charter deals with more than just the issues of poverty and social exclusion. In Croatia, action brought under the Social Charter has led to changes to homophobic school textbooks being used as part of an educational program called Clean Start.
This part here is about homosexuals, that their parents are to blame for their homosexuality because of the irregularity in the family relations. This part here is about the HIV/AIDS, and it talks about how homosexuals are promiscuous and that's why they are more inclined to HIV/AIDS than the heterosexuals. This program taught young people that homosexual relations are deviant. It promoted gender stereotypes. It taught young people that condoms cannot protect them from HIV, AIDS and other sexually transmitted infections. They also promoted the idea that stay-at-home mothers make for better families.
Of course, Croatia is a deeply religious country, strongly rooted in old traditions. But after complaints from parents alleging that one teacher had described homosexuality as a disease, Natasha Bjelic's organisation took the matter up with the European Committee on Social Rights, guardians of the Charter.
The
Committee on Social Rights said that this is in violation of Clause 11 of the Social Charter covering health rights, and in this case, those health rights included sexual and reproductive health education without stereotypes or discrimination. The Croatian authorities reacted very positively, and the government withdrew those books from schools.
The parts Natasha Bjelic's organisation found most offensive were withdrawn, although she says the new books
because some of the textbooks say that homosexuality is a matter of taste, or they explain homosexuality together with incest.
In Croatia, gays, lesbians and transsexual people face a lot of hostility. The most recent Gay Pride March in Split required police protection from other citizens. Even in more liberal Zagreb, life is far from easy, and campaigners say it starts in the schools.
There are two big researches done within the high school students population, which clearly showed how the homophobia is still present in the high schools. Around 70% of the kids are extremely homophobic. And also the other research on curriculum says that they actually don't have a chance to learn anything about homosexuality except the negative prospects.
Getting member states to change their laws is a challenge, but it can be done. Getting populations to change their attitudes is more difficult. Often it all comes down to money. Vasil Cheprazov edits a newspaper for his fellow Roma in Sofia.
Economics is a key issue, so basically employment opportunities are essential, so that people could have access to more services and enjoy a better life.
The majority of Roma are poorly educated, and that's an impediment because it makes them less competitive on the jobs market. So yes, there's definitely a division.
The Roma are Europe's largest ethnic minority, probably some 15 million people. They're often despised by their non-Roma neighbours, and they've suffered discrimination for centuries.
Conditions have never been good, and when you have those kinds of systemic problems are difficult to address. But with the proper political will of governments, those problems can be addressed.
Until that happens, however, and 50 years after it was agreed, the Social Charter is still a vital instrument in defending everyday rights.